Okay, so I'm going to introduce myself. I'm Ali. For those of you that don't know me, I'm a skin professional and I've been with Enzino for around 3 years now. And I just want to say thank you all for joining us tonight, or maybe morning if you are in Australia. I know it's early in the morning for people in Australia. And I really appreciate you coming on the call so late and appreciate your time. But I am super excited for this call because we have three absolutely amazing speakers lined up for you. Whether you're on your fertility journey or simply looking at to support your reproductive health, you're in the right place. So together, our experts will share gentle guidance, expert advice, and the crucial role that nutrition plays in optimizing fertility. So I'm going to introduce you to our experts. We have got Laura. She is a specialist fertility and pregnancy loss coach and holistic therapist by using a unique combination of NLP, mindset coaching skills, EFT, emotional freedom techniques, and hypnotherapy. Laura helps women to feel calm, confident, and emotionally in control whilst on a difficult fertility journey. And we also have Margie. She is a registered nurse with 35 years of experience, a midwife, a fertility expert with 14 years working in IVF clinics in Australia. She is super passionate about helping her clients with evidence-based strategies to optimize treatment outcomes and support pregnancy success. And we have Vasanti, who is a medical health and herbal wellness practitioner and clinical research scientist for the NHS. She is passionate about raising awareness of herbal medicine and natural solutions for fertility and women's health. This is a safe place to learn, connect, and feel supported on your journey. Again, if anyone doesn't want to have their camera on, please turn your camera off. We will stop the recording after the guest speakers have spoken. So if anyone wants to ask some personal questions that won't be recorded, you might want to just make notes at that point instead. So I'm going to get straight on. We're going to start with Laura. Laura's going to talk for a little bit and we'll carry on the conversation. So Laura, can you talk about how the mind-body connection and stress affects fertility?
Yeah, thank you, Ali, for that introduction. So just for those that might have come in a little bit later and missed who I am, I'm a specialist fertility coach. I'm also a holistic therapist, a qualified practitioner in hypnotherapy and EFT, which is otherwise known as emotional freedom technique. You may have heard of something called energy tapping. In addition to that, I'm also a gut health practitioner and a fertility nutrition specialist. And what I do is I provide the emotional and physical and well-being support to women who are on this really awful, difficult fertility journey. This is the support that I wish I had access to when I was going through a difficult fertility journey 20 years ago. Unfortunately, it wasn't on offer then, and I had to suffer and go through this journey completely alone without any sort of professional support. So that's why I came into this job, and that's what I'm doing now. And in a minute, I'll answer your question, Ali, but just a little bit of background for perhaps those that might not have been on a fertility journey themselves, but know maybe other people that have been, or perhaps you're on the call tonight because you are on a difficult fertility journey. When my clients come to me, they are seeking that support because they are so consumed and overwhelmed with such a range of emotions that they don't quite know what to do with those emotions. Now, emotions aren't necessarily bad at all. It's how we use them to guide us positively in the right direction. And often my clients have come to me at the point where these emotions are so overwhelming that they feel like they're completely spiraling out of control with their thoughts, actions, and behaviors. And often they're told, just relax, just chill. It will happen when it's meant to happen. And it's a great comment to make to somebody, but not necessarily when you're on this unpredictable fertility journey. And especially when they're feeling so stressed and that stress is so heightened and overwhelming with what they're going through. Um, Not knowing whether they're ever going to be the parent that they perhaps have dreamt of being all their entire life, that big fairy tale of being the mother or the father. And these comments and these life stresses are just adding to that stressful, unpredictable journey. And it's like being on a roller coaster, sort of going from that hope to fear to despair to disappointment. And it can then bring in lots of feelings of inadequacy, guilt, pressure from society in general, family, friends. And these can lead to emotional blocks and triggers. And that can then in itself affect confidence, self-esteem, relationships, ability to work effectively, all sorts of things. And many people, individuals, experience that fear of failure, anxiety, anxiety about the unknown, with that unpredictability, or maybe possibly past or present traumas related to pregnancy loss or not being able to fall pregnant at all, or medical experiences even. Now, that unresolved trauma can also create chronic tension in the body, leading to increased inflammation, hormone imbalance, and disruption in the menstrual cycles. So these traumas, have a huge effect on the way our mind and body work together. So in answer to your question, Aly, the mind and body are absolutely deeply connected. And stress and anxiety or negative emotions can absolutely impact reproductive health. Absolutely, no doubt. There's scientific evidence and research out there. And without going to becoming too scientific, though, these chronic stress triggers release cortisol and adrenaline, okay? Those sort of hormones that we do need occasionally when we need those, but they can interfere with hormone production, they can disrupt ovulation, and they can affect sperm and egg quality, in fact. So in contrast, if you have a calm, balanced nervous system, then it's going to have the opposite effect. It's going to support that hormonal signaling, that blood flow to the reproductive organs, and create that optimal fertile health, really ready for conception. We've all heard of couples who perhaps have tried for years, maybe stopped trying, gone on holiday, suddenly fallen pregnant. Maybe they've gone for adoption route or the fostering route, and suddenly they fall pregnant naturally. And it's not really a coincidence. It's because they have switched off in their mind. Their subconscious is sort of not, the forefront, and they've calmed down, and everything in their body is sort of not on heightened alert. And so their mind and body are in a much, much calmer place. And the reproductive hormones are far more favorable for conception. So therefore, managing stress is absolutely key to supporting fertility. And that's where my support as a fertility coach and holistic therapist comes in. I'm part of the jigsaw piece. I'm not the entire jigsaw. There's obviously other elements that are going to come into play, and it could be physical medical reasons, or it could be, inflammation levels. I know we're going to be talking about that later. It might be due to diet, all sorts of parts of the jigsaw. But one big part of the jigsaw could be that they are feeling so stressed with everything that's going on in their journey and what's going on around them, that is causing a block somewhere within the body, because the mind and body are absolutely working in harmony together. And that's what we want to happen. So I teach or help my clients to develop strategies. We look at what's going on in their life. We look at how they can overcome limiting beliefs and any fears that might be going on. We incorporate strategies such as meditation, deep breathing, which is incredibly important, to know how to breathe, to become more, in tune, and things like journaling, affirmations. Physical health, diet, supplements, which again is something that I know Vasanti and Margie are going to be touching on in more detail, but I also look at that with my clients. I look at them and support them in a holistic way. I also use my EFT, which is emotional freedom technique, otherwise known as energy tapping, which helps to calm the stress center in the amygdala down and regulate the energy in the body. And it's known as a psychological version of acupuncture. And then there's also hypnotherapy. Again, it depends what the client needs, what they come to the session with, what they might need, what I feel they need. I don't do everything every session. It's completely unique to the clients, but it's all different ways and strategies of helping to reduce the stress.
Oh, thank you so much, Laura. That's really, really interesting because we can't just all be doing all about just inside. We really need to think about the mindset and stuff in the mind.
Absolutely.
So thank you so much for sharing that with us. I'm just going to go to Margie now, and we're going to talk a little bit more about how what the role of omega-3 plays in fertility.
Okay, thank you so much, Aly. And it's a real privilege to be here with you, because to put together a panel that you have, and, you know, for people to learn and understand that trying to conceive and your fertility and reproductive health, it is a holistic approach. And like Laura said, you know, these are all little pieces of the puzzle that we need to put together in order to achieve success. So for me, as Aly said, my name is Margie Dangerfield, and my background is I'm a registered nurse and a midwife. I've also done hypnobirthing education, which is definitely all about the mind-body connection as well. So for me, I really want to stress the importance and the role of omega-3. But before I do get into that, just to explain why I became so passionate about this, because I was working in infertility in IVF clinics, busy IVF clinics in Brisbane in Australia, and I came across a personalised test-based nutritional approach, and something that all of the IVF patients who were desperate to have a baby, and they were doing all the right things, you know, exercising, the yoga, the mindset, eating, eliminating certain things from their diet, they would always ask, what else can we do? And a lot of the times when you're looking at supplementation and nutrition, people are guessing. So they're just not sure what exactly do they need to be focusing on. And I was very fortunate to come across Zanzino and to implement that into some strategies that I was working with our fertility clients. And one of the things that is an absolute game changer is understanding the role of omega-3. So for those of you that don't know, omega-3 is an essential nutrient, and it plays a critical role in your fertility. In fact, you know, conception is functioning at a cellular level. And omega-3 is a nutrient that is fundamental to your cellular health. So if we don't have this foundation right, and we're found to have the deficiency of omega-3, then that's going to impact the quality of your eggs, the quality of your sperm, your endometrial receptivity, the thickening, and of course, a baby's only source of nutrition is from the mother. So if the mother is omega-3 deficient or any nutrient deficient, of course, the baby's going to be deficient as well. So how does that impact fertility? Well, omega-3, let's talk about, well, first of all, I want to say inflammation is one of the drivers of all chronic disease, and infertility is no different. So I worked very closely with so many girls with endometriosis, PCOS, also male factor, recurring pregnancy loss, unexplained infertility. So all of these people that were coming in for IVF treatment had a very common factor, and that was chronic inflammatory stress. Now, that's why it was incredibly important to me that when I found out the information about Zanzino's balance test, we could actually determine what the level of omega-3 was at a cellular level for our patients. So I started to really investigate and explore how we could pass this information on to our patients. And Zanzino have put out a test. This is an independent third-party test. It's called the balance test, and it actually can identify your omega-3 index. So it also looks at the ratio of the essential fats comparing omega-6 to 3, because if that number is high, you have chronic inflammatory stress. And when you're trying to have a baby, that is critical to understand, because if you have inflammation, that accelerates the metabolic aging process. So what that means is it's accelerating the age of your eggs. You will not have optimal functioning quality eggs and sperm if you have inflammation and oxidative stress. So it is absolutely vital that you talk to the person that invited you to this call to understand how to get your hands on one of these tests. It's designed to be an at-home test, and it reveals so much information about omega-3. Because if we can control the inflammatory process and put a brake on your inflammation, then we're going to improve the quality of your eggs and sperm. And that's good news for fertility, because what that means is that we can optimize your treatment outcomes and your success to pregnancy. One of the most overwhelming things we saw was the reduction in chronic pelvic pain for women with endometriosis. Why? Because endometriosis is an estrogen-driven inflammatory condition. And when we were looking at these biomarkers, we would see these women that had such a deficiency in omega-3, and they had high omega-6-3 ratios. But when in the very first cycle of these girls getting onto the solution to having a high inflammatory marker, we would put ladies onto the balance oil, which is actually not a commercial grade fish oil. So it's not good enough to just say, go and take an omega supplement. There's 500 million taking omega supplements, and 97% of the population still have a deficiency in omega-3. So standard commercial grade fish oil doesn't work. Okay, it's not going to move the dial on your omega-3 index to the same point that the balance oil will. Why? Because commercial grade fish oil is actually oxidizing very quickly in the body, and Zanzino have created a formulation that doesn't oxidize. It's mimicking nature. It is a formulation from olive polyphenols, which has a very high oxidative stability index. That means it's not oxidizing in the body. It's stable long enough to reach the cell membrane. And that's where the magic happens. That's where we can break that inflammatory drive. So I would highly recommend people, if you are wanting to optimize whether you're going through IVF, you look at the biomarker most importantly as a starting point. And this is something that I would like to see implemented into all IVF clinics as a baseline biomarker. It's such valuable information for you to have. Now, everyone who's going through a treatment or wanting to have a baby and optimize their fertility, obviously they're looking to have a baby. So as I said, the baby's only source of nutrition is the mother. So if the mother is low on omega-3, then of course the baby can't achieve its optimal target values, which is absolutely critical for the baby's neural pathway development. So, and that's why we do see this correlation between women with low DHA values, in the literature, where we're seeing a correlation between women who are having children with autism spectrum, ADHD, learning behavioral disorders. And so when we do have mothers optimize their values, they're reducing that risk. And the other key thing I want to point out too, Ali, is that women with low DHA values, they also are at a higher risk of having early preterm birth. So for me, when I talk to women who are trying to conceive or who are pregnant, I encourage them to take the test and absolutely correct those values, because that's something that they can minimize that risk. And the other important thing for women and couples to understand is that there is also a strong link between low omega-3 values and the risk of postpartum depressive symptoms, because, you know, that is quite prevalent. And if we can reduce that risk of that occurring, I mean, it's tough anyway for people to cope with the demands of having a new baby anyway. But if you are deficient in this essential nutrient, then that's going to put you at a higher risk of that as well.
Thank you so much for that information. And also, for the men, we also just say that the men need the omega-3 as well for optimal health as well. There's some studies, I think, isn't there, on
Yes, a lot of literature that you can improve sperm quality with optimizing omega-3. Absolutely, DHA.
And I think there was a study about miscarriages, and that was due to the men's sperm health. And if I'm, correct me if anyone's got that data, but I'm sure there was some data. I'm not sure if it was 40% of miscarriages came some of the data. So I'm not sure if anyone knows about that one. I think Amanda, hold on, let me just ask to unmute. Can we unmute Amanda? Ask to unmute. No, can't unmute you. I don't know why. Can one of you try? Just because she's got that data. It was quite an interesting fact. Here we go. Yeah, go on, Amanda. Yeah.
No, I haven't actually got it in front of him, but I'll do a lot of research and read around about it anyway. So yes, and up to 40 to 50% of male infertility is now impacted by sperm health. And as Margie was saying about the cellular health, it's very much the same with sperm. In fact, when we look at the cellular health in the eggs and the quality of the eggs, and we look at the health of the mitochondria, which the mitochondria is the energy and of the cells. Egg cells actually contain more mitochondria than the general cells in the body. So equally in sperm, the sperm also has a cellular membrane, which is predominantly composed of DHA. So, and the tip of the sperm, which is the acrosome, is also made of DHA and omega-3, and it helps that to become more permeable in order to penetrate the egg for conception to occur. So therefore, when we have all the issues with sperm quality, omega-3 is being found to increase sperm shapes, sperm motility, all these factors which are important for conception to occur. It's lots of it is related to lifestyle, diet, plastic, endocrine disruptors, and all these things. So yes, there's lots and lots of research out there about sperm quality.
We can put that into the chat as well afterwards. So if anyone's got any questions on the way, then please let us know. So I'm just going to go to, and then we can have a general chat afterwards as well. So I just want to go to Vasanti, and how do gut health and hormone imbalances affect fertility? If we can look at the gut health, please.
Thank you, Ali. Thank you for your lovely introduction. And for anybody who joined later, I'm a medical herbal practitioner and a clinical research scientist at the NHS. I'm just going to do a quick introduction to herbal medicine. Can everyone see that?
Yeah.
Okay, great. So my practice is called Gaia Herbal Therapy, and I'm going to tell you a little bit about herbal medicine just quickly before I answer Ali's question. So herbal medicine is extracted from plants primarily in the form of bark, flower, root, whole plant seed, rhizome or buds. Originally, medicine was discovered from plants. Nowadays, most medicines are made synthetically based on the components of plant extracts. But there still are some medicines that we can't make synthetically, such as digoxin. There's also herbal medicine extracted from mushrooms, and mushrooms are very effective for immunity, autoimmune nervous system and cancer, and there's some bee products as well. This is just outlining the different forms of herbs that can be consumed, so in tincture or oil, herbal teas. You can have them in capsules, powders. You can even use them topically, making poultices or applying different concoctions of herbs for wound infection or wound healing. So what's the natural application of herbs for fertility? The approach is mainly to look at whole body function, and then that's just following on from what Laura and Margie have said of looking at mind, body and soul, stress levels. So we look at overall health as well as nutrition, and these are the main areas we focus on: the immune system, stress and nervous system, the digestive system, circulation and menstrual health. And the reason digestive system is here is will become apparent a bit further on. So the digestive system, which starts from the point of the food entering the mouth, where the saliva is released in the mouth to start the breakdown of the food, all the way down to excretion. There's different functions that occur throughout the digestive system, and so the digestive system could be affected at any point or multiple points. For example, if the liver is sluggish, or the food isn't chewed properly, or the pancreas isn't working, or if there's inflammation anywhere in the intestines. And so it's quite important to understand how the digestive system is working. And then this information tells us, gives us information about hormonal breakdown, because if hormones aren't broken down properly, that feeds back to the body incorrectly, and then it affects menstrual cycles and other things. I could go into more detail, but it's probably not appropriate here. And also, if the digestive system isn't functioning properly, or there's inflammation, it's going to affect nutrient absorption, and that's just tying up with what Margie said about omega-3 and other nutrients. So once we have this information, we can start to build a plan of the type of treatment and selection of herbs. And we also look at the sexual function. So we want to know about this, about the sexual history, the cycle history, the flow, any previous infections, abortion, miscarriages, and similarly with men, we'd be asking questions about sexual function, erectile dysfunction, that sort of thing. Somebody who may have used oral contraceptives for a while, their menstrual cycle may need regulating, and we need to understand whether it's due to the oral contraceptives or another reason, another physical reason or hormonal reason. And so the herbal applications here, I've just given a few examples. Chasteberry, primarily used to regulate the menstrual cycle. Raspberry leaf tones the tissues and tightens the tissues. Black cohosh is used for digestive system in some cases, but it's very good for PCOS and excess estrogen, ovarian insufficiency. Something like meadowsweet would be used for inflammation, primarily in the digestive system. Tribulus for male infertility, erectile dysfunction, as well as uterine disorders and gonorrhea. Wild yam for spasms in the pelvic area and optimizing estrogen and improving cervical mucus. And then addressing the nervous system and stress, we would be looking at herbs like Siberian ginseng, licorice, romania, and they act at the hypothalamic pituitary adrenal axis, which is the areas in the brain that are primary to releasing hormones. And then we also look at nutrition, because we want to see the type of nutrients that the person is taking in. So we normally encourage rainbow-colored fruits and vegetables, as well. I haven't put nuts and seeds and other things, but they're also important. Reducing smoking, alcohol, coffee. There's lots of research around this. There was a study done in this country where there was intervention for couples who are having problems conceiving, and the rate of pregnancy improved after correcting nutritional after correcting their diets and improving their diets and making some changes like reducing alcohol and smoking. And these are the key kind of nutrients we look at. Margie's already talked about omega-3. You wouldn't get that from fruit and vegetables. You'll get that from oily fish primarily. But there's lots of evidence now, lots of research showing that even having oily fish 2 or 3 times a week, you still need to supplement with omega-3. And then some of these other nutrients are also important. So just following on from the Zinzino products, I found the Zinzino products really interesting because the balance oil has got not only omega-3, but it's got vitamin D, and vitamin D improves pregnancy rates and also the quality of the embryos. And some of the other products I'll talk about a little bit later on. So yeah, just reiterating what I said. And then the xenobiotic improves digestive health primarily. It's got lots of herb extracts, especially fiber. And the Extend has essential multivitamins and nutrients, but also, this is really interesting for me as a herbalist, also herbal extracts and vegetable extracts. So again, I was quite excited about that. And these supplements tie in really nicely with what I would be looking to do with anybody who needed support with fertility. So just finishing off, I just want to say thank you to Laura Bloomberg for bringing us all together. We haven't finished the talk yet, but I just wanted to say thank you. Thank you to Alison for chairing this evening, and Margie for joining us all the way from Australia. Thank you to Zinzino, and thank you everyone for attending. And I'll let Ali open up the floor for further questions.
Yeah, no, thank you for that. With the Extend, I just want to add in with this Extend, which is a multivitamin immune support. It's actually got something called a quadruple folate acid in it, and that really gives a boost to people that want to add in that folate acid into their diet as well. So that is something that we need to appreciate, that the Extend has so many good nutrients in. We haven't addressed how the xenobiotic affects the fertility. Perhaps, Margie, do you want to go into a little bit on how that will help people and their fertility, and so the unique blend of that xenobiotic? And if anyone wants to put in any specific questions on endometriosis, PCOS, or any problems that they may be having, please put that in the chat, or you can actually message me or whoever invited you on the call privately, and we can also read out those questions.
Yeah, absolutely. I'm a big fan of Xenobiotic. It's a beautiful blend of soluble fibers. In fact, it's a scientifically formulated product that was designed to ferment. They worked out the transit time of each individual fiber to ferment through the entirety of the colon from the beginning to the end. So that in itself is very clever. It is gluten-free, but the design of it is to, produce healthy bacteria and change the microbiome into more positive, so a gram-positive dominant environment. And this is really important for fertility because it influences all aspects of your health. But we know that people with PCOS, with endometriosis, with recurrent pregnancy loss, unexplained infertility, they all have more pathogenic or more bad bacteria circulating in their gut. So we can do a lot just by using this simple strategy to implement on a daily basis, because the vast majority of us are not having enough diversity of fiber. So that's why this was introduced, is to say, just add this in to your daily routine. And one of the compounds that's actually produced from the fermentation process is butyrate. And there's a lot of research around this, particularly for what I see with the endometriosis group of people that are trying to conceive. We know that butyrate has shown to slow the progression of endometriotic cellular growth down. So, you know, these girls get tremendous improvements just by using the balance oil and prebiotic. So because they have all sorts of problems, not just with their bowel, with bloating, and, you know, as we know, it's a systemic problems that they have. So yeah, I'm a huge fan.